Well, good morning. I'll call the Audit Committee meeting to order. Sonia, would you like to begin by letting us know who's present in the room?
Mr. Cruz, I couldn't hear you well.
I just said, would you like to let us know who is present in the room?
Yes, in the room where I am, and I'm on the 19th floor, I am in the room, Sonia Allen Smith, Inspector General, and I also have Taisha Crow, our executive admin. I understand that on the 18th floor, Chairman Boyd is there, and I'm not certain who else is present.
Okay, thank you. Then we have the agenda.
Boyd, David, yeah, I'm in the room here next to the Commissioner's office on the 18th floor, watching on TV screen. So let you know I'm here.
Thank you, Chairman Boyd. Sonia has displayed the agenda that we was presented ahead of time. And I'd just like to welcome everyone to the meeting. The first item on the agenda is to review the minutes of September 8th, 2022 and March 9th, 2023. Those minutes were sent out ahead of time. At the September 8th meeting, the committee heard a presentation by the Department of Audits on the 2021 audit. And the minutes reflect the detail of that discussion. Then the March 9th, 2023 meeting was a discussion led by the department reviewing the 2021 audit and the steps that the department had taken to address the findings. Let me pause at this point and see if anyone has questions or comments about the minutes of those two meetings. If not, then we'll proceed ahead. Sonia, with any opening remarks from the department.
Yes, thank you, Mr. Cruz. Joe, are you on the line?
Morning, Sonia. Yes, I'm in here with Chairman Boyd.
Will you do the opening remarks, please?
Certainly. Well, welcome everyone. Thank you for joining us this morning. We've got a little bit to go over from our findings that we've had our exit conference on for the audit committee, and Sonia has prepared the review that has been shared with you previously. Many of these findings were with us from prior audits, and there are a few new ones, but I don't think that there's anything to be alarmed about, and she'll go through those in summary, and then we can certainly answer questions and respond appropriately if you have questions. Sonia, I'm going to turn it over to you.
Thank you, Joe. We're just trying to get to the pages and turn them or rotate them so everyone can see them. Give me just a second. If you can bear with me for a second, we'll get the page turned. Mhm.
Sonia, if we're having trouble displaying it, we should just forego that. I mean, I think we do have, it's presented previously to members, so we can reference it and continue to try as you start.
Okay, Joe, we've opened it up in Excel.
Yep, that's displaying great. Thank you.
Okay, thank you. My apologies for that. We practiced that, changing that, switching that around, but it didn't work once we got on the call. So the version that I have before you is my shortened version of the document. The actual document in the email that was shared by Ms. Williams has the actual language from the actual audit report. So I will begin my report now. Again, my apologies for the delay. Good morning, Chairman Cruz, Chairman Boyd, Audit Committee members, Commissioner Nagle, and other DCH executives and colleagues. At our last Audit Committee meeting in March, we reviewed the corrective action plans for the 2021 statewide single audit findings. Today, I will review the findings from the state fiscal year 2022 statewide single audit findings. This audit was recently finalized. We thought we'd use this opportunity to review those findings with you now. From the 2022 audit, DCH received 11 findings. Of these 11 findings prior year, and 3 are new. As I review each finding, I will spend more time on the new findings. The prior year findings continue to be findings for several reasons. The findings / recommendations have not been complete or were not completed by the end of the state fiscal year 22 audit. Another reason why these prior year findings remain is because the finding was not fully resolved at the time of the audit. And therefore, DOAA decided to make it an audit finding, continue that audit finding. I also believe that the business owner of each finding has joined us this morning on this call. In case there are specific questions, these findings that you will see are related to the Division of Financial Management, the Office of Information Technology, Reimbursement Services, as well as the Medical Assistance Plans Division. And again, I will refer you to the spreadsheet that was sent to you via email in the audit committee package that was sent out by Ms. Williams. Again, the document displayed is a shortened version of that document. In this document, you will see that the 2022 finding is identified. The recommendation is here. It also identifies if the finding is a new or repeat finding from 2021 or prior years, as well as an estimated date of completion. I will speak briefly to each finding today. And again, additional information will be provided to this committee in the future once we have fully developed the corrective action plan. I'll go ahead and start with the first finding, number 1. This first finding is a new finding and belongs to the Division of Financial Management. It is strengthened accounting controls overall. The finding reads that DCH has strengthened internal controls over accounting and financial reporting processes and procedures to ensure the accuracy of the information it prepares for the state's financial statements and notes disclosures. The department strongly disagreed with this finding, but ultimately, the Department of Audits and Accounts decided to provide the following recommendations. I will summarize the recommendations so as not to read all the details to you that is in the report that was sent out by Ms. Williams. The Department of Community Health should strengthen its controls over its accounting and financial reporting processes and procedures. DCH should commit resources to manage the bank reconciliation process, as well as ensuring that all policies and procedures are properly reviewed and approved. A few points that I'd like to mention to you about this finding. In the documentation that you received in your board package, there is a reference to a PCA. A PCA is a post-closing adjustment. Post-closing adjustments have been necessary in DCH to ensure that the financial statements are presented correctly. Processes are in place to reduce the need for correcting on the back end of the accounting process as much as possible. Resources have also been provided to the bank reconciliation process. We had many reconciliation items that needed to be researched and addressed from prior years. The accounting team has worked diligently to eliminate those concerns. Lastly, additional processes have been implemented to ensure that the information is reviewed thoroughly and policies and procedures have been prepared to make sure that items are approved at the appropriate management level. The estimated completion date for this finding is October 16th, 2023. The second audit finding belongs to the Office of Information Technology. And it's entitled Continue to Strengthen the Application Risk Management Program. Note that this finding appears twice. It appears as a financial statement finding as well as a federal award finding. The finding itself is this: DCA should continue to strengthen controls over its application risk management program. Now, this finding may be familiar to you as it is a repeat from several prior years. The recommendation to DCH is that we should continue to allocate resources to implement a formal risk management program. We should review and assess SOC reports and develop a process for tracking the results of these reports, of these reviews. Now, if you're wondering what is a SOC report, SOC stands for a Service Organization Control. The report is a way to verify that an organization is following some specific best practice. The reports, which are created and validated by a third-party auditor, are built to provide independent assurance and to help potential customers and partners understand any potential risk involved in working with the organization that was evaluated. SOC reports are also important because they provide thorough business overviews delivered in a common and consistent framework. OIT anticipates that the completion date for this finding will be December 31st, 2023. Now, the next 5 findings are repeat and they belong to the Medical Assistance Plans Division. We discussed these at our last meeting, so I will not spend much time on these. Finding number 3, improve controls over managed care organization financial audits. The finding reads that DCH did not have adequate controls in place to ensure that the required managed care financial audits are being conducted or that the results of the required periodic audits are posted to the state's website. The recommendation to DCH is to require that the MCOs submit on an annual basis audited financial reports. The second recommendation in summary is to implement policies and procedures to post these reports to the state's website. Now, this process is currently being addressed through the contracts process. We have also been working diligently to get these reports posted to our website. Our estimated completion date for this is June 30th, 2023. Finding number 4, improve control over Medicaid payments after date of death. The finding reads that DCH made improper payments to Medicaid providers after beneficiaries' death. The recommendation is that DCH should ensure that GAMIS modifications to the date of death processes are implemented and that Medicaid benefit payments to providers are not made after beneficiaries' death. Second recommendation is to investigate and recover funds for all overpayments and, if necessary, refer these cases to the Georgia Fraud Control Unit for any potential provider fraud or abuse. And then finally, we are to consult with CMS regarding any question costs. The estimated completion date of this is June 30th, 2023. Number 5 is to improve controls over payments for home and community-based services. Our finding is that DCH made improper payments for Medicaid home and community-based services while members were in a long-term care facility. The recommendation is that DCH should strengthen its internal controls over home and community-based services payments. We should implement analytical procedures or system modifications to identify improper simultaneous payments, as well as consulting with CMS on the question costs. The estimated completion date for this one is also June 30th. I will pause here and just say that for findings number 4 and number 5, we've made some improvements to those. So 630 is truly reachable. We've been working on this since actually last year. So we believe firmly that we'll be able to make this go away by June 30th.
Excuse me, Norm Boyd, can I ask a question?
Yes, sir.
The items here that we have are showing for completion dates June 30. That's coming up pretty quick. My question is, for the department, are we satisfied that we will make that date on those items?
I would like to answer that and say, yes, we've made some strides as it relates to these findings. These are a few of the findings that I referenced that we were able to make some completions on these items, but because they weren't quite finished at the point of the audit, they continue to stay on our findings list. But I feel confident that we've done the work and we should be able to make the 630 deadline.
Okay, so is there a process in place to check that so that so it's verified that those things have been completed?
Yes, there is a process in place, and that process involves working with program integrity, who works with the MAP program to make sure that what we anticipate happening with these recommendations are actually coming to fruition.
Thank you.
Thank you. I think I'm on number 6. Okay, number 6. Yep, improve controls over Medicaid capitation payments for Medicaid members. The finding is that DCH made improper capitation payments for the Medicaid managed care members with Medicare insurance coverage. The recommendation is that DCH should dedicate resources to ensure GAMIS modifications, retroactively recruit capitation payments from its MCOs upon receipt of notice that a member is eligible for Medicare. We were also instructed to perform analytical procedures over Medicare effective dates for managed care members to determine whether capitation payments have been recouped. We have also been instructed to investigate and recover funds for all improper payments. And finally, we will consult with CMS regarding question costs. For this particular finding, this recommendation was placed into production on April 1st, 2023. It was pending the end of the public health emergency. So that's why you see the 4/1 date. So that this change has been placed in production already. Finding number 7. Improve controls over Medicaid capitation payments for managed care recipients. Our finding is that DCH made improper duplicate payments for Medicaid managed care recipients. The recommendation is that DCH should dedicate resources to enter accurate rates annually within GAMIS. We should perform analytical procedures to identify potential MCO overpayments. We will investigate and recover funds for all overpayments. We will also consult with CMS regarding these question costs. The estimated completion date for this finding is August 31st, 2023. Finding number 8. This finding belongs to the Office of Reimbursement Services. It is entitled Improve Controls Over Medicaid Capitation Payment Rates. The finding is that DCH made capitation payments for Medicaid managed care recipients using the improper payment rates. Our recommendations are that DCH should dedicate resources to enter accurate rates annually within GAMIS. We are to perform analytical procedures to identify potential MCO overpayments. Again, we will investigate and recover funds for all overpayments, as well as consult with CMS regarding the question costs. The estimated completion date for this finding is June 30th, 2023. The next 2 findings belong to IT as well. They are related to what is called NCCI edits. NCCI is an acronym for CMS's National Correct Coding Initiative. The CMS National Correct Coding Initiative promotes national coding methodologies and reduces improper coding, which may result in inappropriate payments of Medicaid claims. The 2 findings that we received as it relates to the NCCI program are to number 9, are to strengthen our controls over the NCCI program requirements. Our finding is that we did not have adequate controls in place to ensure that the confidentiality agreements with contracted partners contained all the required elements. The DCH recommendation is to revise our confidentiality agreement with Gainwell. We anticipate to have this completed no later than September 30th, 2023. Our last finding, also related to NCCI, is that DCH should improve controls over the NCCI medically unlikely edits process. Our finding is that we did not have adequate controls in place to ensure that documentation is maintained on file to evidence the CMS approval of the National Correct Coding Initiative edit overrides. Our recommendation is that DCH should strengthen controls over its approval process related to these overrides, as well as consult with CMS regarding question costs. We have identified June 30th as our completion date for that specific finding. I have reached the end of my presentation. I would like to pause for any questions that you may have.
Yeah, Norm Boyd, I have one question here. Going back to the first finding, and you made, the statement was made that DCH strongly disagrees with that finding. But yet we've got in place here corrective actions to be completed by October 16 of 23. It is the audit and the department now in alignment that this finding is something that the department is going to complete and rectify, or is there still a disagreement on that?
Sonia, if I can speak to that.
Okay,
So Mr. Chairman, it's two parts. We had ongoing efforts to make improvements in these areas to begin with, and that's really referenced in the corrective action that you're speaking to. But overall, we disagree that that the finding truly exists in the manner in which they've stated. And we continue to state that we believe that at the end of the fiscal year, that we come into compliance and demonstrate compliance for internal controls, accounting and financial reporting. As you and other board members are aware, the department has a very large cash flow through our banking accounts, and that's due to the fact that we have to draw funds from the Centers for Medicare and Medicaid and draw funds from the state allotment process in order to make the daily payments that go out for Medicaid members and to the CMO, the care management organizations that pay them. So in both processes. And that cash flow creates a challenge in reconciling bank reconciliations on a monthly basis, because you have to make sure that you have all of your revenue booked and all of your expenses booked and truly show outstanding items. We've made concerted efforts to do that as best we can. However, we have had some backlog that was there on booking some outstanding items that the auditors are referencing. And they contend that that demonstrates internal control weaknesses. We disagree with that. But irrespective of that, we believe that with the corrective action, that we certainly will be in compliance. I just wanted to provide the audit committee with some of that understanding here today. So we currently have under contract Ernst & Young to do an automation project in financial services. And that is a multi-million-dollar effort to automate processes that are directly related to this area. Now that just is coincidental in that it is going to address that. We started that process over a year ago in our analysis, realizing that due to staffing challenges that we have, that we needed to find means to automate. But EY has identified a number of areas where we'll save, probably a couple of 100 hours of staff time and automate redundant processes you do in a bank reconciliation to book revenue and to reconcile those bank accounts that can be done through what a robotic process automation or RPA. EY has experience in those efforts. So there are a number of those that we anticipate by the fall timeframe will be automated and will address this primarily. And then in addition to that, we've had staff all along that have been working on reconciling the items that they had identified. That was an ongoing effort prior to them identifying. It was not new things that they found and showed us, which is one reason we strongly disagreed that we had a control process, because generally, if you have an internal control challenge, it would be something that you're unaware of or that you were not addressing at the time that it was occurring. And that was simply not the case. And we thought we have and believe we have that fully in hand, but the auditors felt that through transparency that they should document that as a finding. So we find ourselves in this place with the finding, and it may be that this finding continues into next year's audit if we don't have our automation processes complete, or if we don't sufficiently have the backlog addressed to the auditor's satisfaction for the finding. However, I suspect that certainly as we go into 25, everything will be addressed sufficiently, and this should come off completely. But we believe we have it completely in hand and will continue forward. So it's strongly disagree because we don't believe that we really reached the threshold of where it should be a finding. But irrespective of that, we're making efforts that I think will all be in alignment as you ask.
Joe, thank you very much for that explanation. That clarifies it in detail. Thank you. No other questions from me.
Thank you. Mr. Cruz, I have completed my presentation if there are no other questions.
All right, thank you very much, Sonia. I'll just pause a minute. I know we've got a couple other board members on the line, and just see if any other board members have any questions or comments they'd like to make at this time. If not, Sonia and Joe, I just want to say thank you for a very thorough presentation and documentation. Very helpful to follow these findings, and I think it's very good that the department has a timeline to address, especially the 3U findings by October 16th. And many, of course, of these findings should be addressed by June 30th. So I see good progress, and I commend you for that. Commend Joe and our leadership for this progress, and we'll look forward at our next quarterly meeting to get an update on the progress of these findings, and to follow back up on year-end 6/30/21 findings. If there's nothing further for the audit committee at this time, we'll stand adjourned.
Thank you.
Thank you.